Okay, thank you very much. I realize it's very short, but if we want to wrap up before people have to leave, I think it's time to start. So please, I would like to start with the first table. So Kate Tulenko, you agreed to report back on the field of infectious disease. So the floor is yours.
Thank you. We had a very good discussion starting with how the private sector needs to be included in the identification and reporting of outbreaks in infectious disease. In fact, we discussed the fact that the patient zero visited a traditional health provider and that person probably hadn't received any type of training in how to report or refer up through either the public or the private health system. We also talked about how to incentivize the private sector to develop and invest in vaccines or drugs, particularly for developing country markets, because it might not be worth their while to do that unless there are advanced market commitments or other types of mechanisms. We also discussed issues of antimicrobial resistance, the need to develop new antibiotics, particularly through the private sector, but also the need to do good stewardship of existing antimicrobials and making sure that healthcare providers are not giving out antibiotics if they're not needed. We had a nice discussion on the issue of trust and that public sector needs to trust the private sector more and vice versa, and how the private sector often needs to articulate its ethics and how it does ethical training for its staff, making sure its staff don't bribe country officials and don't interfere with that process. And we also talked about how the public sector needs to not see the private sector as competition. We often see that private sector is stopped at doing something because the public sector is afraid they'll do it better, they'll make them look bad, and so they need to be seen as partners rather than competition. And do any of my teammates want to make any other comments?
Yeah, we had an interesting discussion just a little bit about transparency. And when it comes to some of the challenges that from the advocacy point of view, I'm with an advocacy organization, it's hard for us to know what the private sector is doing, for instance, in drug development, because of the lack of transparency about what is actually being spent on R&D. So it's a real question that we struggle with, and I think it's one of the reasons why there's such a debate that rages about that issue. And the other, if we look at some of the other aspects of private sector engagement, there's certainly so many positive examples. But there's also other questions have been raised, for instance, with the IFC's investment in primary health care. It's been, in terms of the own evaluation of the World Bank itself, it's been highly critical of that, in terms of promoting private sector engagement with primary health care. So the World Bank's own independent external evaluators have been highly critical of that in terms of gender equity and equity generally. So so there's some real concerns. It's not just a sort of ideological thing or a traditional suspicion, but really practically rooted.
Thank you so much. I think in terms of time, we will move on to our next table. And for the live stream viewers at home, if you could please submit your comments the way you usually do, we will be generating a report that from these conversations then we'll distribute to the different government partners that we work with, because I think it's really important to understand the PPPs. I know some of our live stream audience has pre-submitted questions ahead of time in terms of the PPPs, but they'll also be commenting on the remarks being said at the table, so thank you. I'd like to move on to our next table, Katya and Farid.
Good, thank you very much. We discussed whether we should keep planting trees or going for the full forest, and we decided to go for the full forest. We're going beyond pilot projecting now. When we talk about financing for health, we need to realize that investing in girls and women, when you do that, everybody wins. So we identified some lessons learned, and that will be key in moving forward. And one is on financing. It's the projects that's key. It is when you have the right project, you will get the money. So it is defining the right project with good goals, win-wins, clear and concise, then the money will come. And that leads into the power cocktail of the collaboration between government, NGOs, and the private sector, because we each have competencies, and when you put that together, we can reach every single one. But it also means that the government come in and can help lower risk, that will attract the business, and then you have the NGOs that has a lot of the connection and knowledge on the ground. Then mindset is key. We're moving from charity to shared value. We're moving from being donors to being business partners, and that is key. And in link to that, the language that we use, we need to speak the same language. I always use this. If you talk about sustainability in a sustainable goal context, it's one thing. But if you talk about sustainability in a business context, it's something completely different. And we just need to realize that language we need to share, else we will never get those clear and concise projects where we agree on the goals. Yeah, and then a collaborative business model. And again, we also touched upon, just like one of the other tables, on the whole incentives. But also realizing that if we're gonna work together on this, and we are, because we're already doing it, and this is the new black, that the capacity building for all of us will be absolutely key, and learning together, and keep doing it, and grow that full forest.
Thank you very much, Katja. Thank you. Talking about the next topic, and we had two tables working on the theme non-communicable disease and what can be the role of the private sector moving beyond in public-private partnership. And I would like to ask you, Jacob Gale from the Medtronic Philanthropy Foundation, to talk about that.
Thank you very much. So we had quite a robust conversation, especially as we began, trying to identify the most critical NCDs. We clearly agreed that it really depends country by country, but by taking a whole system solution, being able to really look at both the morbidity and mortality costs upon a country, and being able to identify what costs the most. So an example that was used was stroke, whereby while there may be 1/3 deaths attributed to stroke, the 1/3 that are disabled because of stroke may cost more to a country and a society than perhaps other NCDs. Cancer, we know the savings comes in early detection and intervention. And so each country really would have to determine through that whole system solution approach which of the NCDs are top priority. I think we also talked about the idea that there is a role for industry, there's a role for government, there's a role for civil society. Industry definitely making available the kinds of technologies and products and services that are necessary for intervention. Also playing a role in the training of healthcare providers, healthcare workers, to ensure that they're trained within the setting that they're going to serve, within the resource context they're going to serve. That sometimes means perhaps changing the kind of training that they might have to be adaptive locally. Sometimes it also means ensuring that the level of care and services needed is made present in the country of need. Government, leadership, coordination, policy, establishing the environment for success, most definitely. There was a comment that we could benefit from having a common indicator or a common scorecard that can indicate progress across NCDs, across countries, across sectors. A couple examples of where we've seen success have been in Ghana, where there are examples of actual local maintenance and service to medical devices, hospital instruments, technology. local training that is able to maintain the kinds of services that are needed for providing NCD care. We also talked about the WHO's initiative for essential technologies for cancer management, a great example of the decrease in mortality around breast cancer in some places considered to be low resource because of early screening, being able to detect early, and with the very tangible examples of 10,000 lives being saved per year. And the last thing I was going to mention was that before the South African Director General left, she put out a challenge to us and said, how can we think about making more accessible opportunities for people who are managing their NCDs to be able to have almost a kiosk kind of quick access of medications, rechecking of important indicators of health status, and then being able to continue on in their normal day-to-day lives.
Thank you very much, Jacob.
Thank you so much. And now we'd like to move on to NCDs. So if our colleague from GE, if you can give us a report back.
I have to be honest, we didn't actually focus on NCDs in our discussion, so we took a slightly different approach. I apologize. Still a relevant topic, primarily looking at the introduction of innovative technologies, primarily to address MDGs 4 and 5, and basically took examples from all our representatives at the table to really structure what would be an ideal public-private partnership, what would be the ideal components for a partnership with GE to help introduce a new technology like the vScan Access. So a couple different points that we hit on which were fantastic. First of all, from the GE side, obviously we have the capabilities in terms of product development, but when it comes to introducing that to a new market, there's several critical components. So first thing is quality. Representatives from the US Pharmacopeal Association talked about quality and standard setting. So as you introduce a new product or a new drug, let's say oxytocin in a market, you have to make sure that quality-wise, things are kept in the right storage, that they're supplied and transported properly. The same thing needs to apply to any new technology. There needs to be appropriate standards set and training of the regulators in a particular country to be able to apply those standards to any health worker or supply chain that's distributing a technology. We had a representative from the Egyptian Ministry of Health, and his perspective was that, first of all, there needs to be a very clear agenda and pure transparency when it comes to negotiations between a private organization and a government. So trust, honesty, talking about pricing, why are prices so high? Those kinds of issues really need to be on the table. We talked about analytics. So when do you need research and technology to be able to apply a technology? So in the case of AMR, good analytics around, better detection of antimicrobials and using spectrometry to know when, certain drugs need to be used and where they need to be sold. So that applies to any new technology as well. Also health economics and cost analysis, really looking at the burden of disease and what are the costs of introducing it and what are the costs of not introducing it, and making sure that that's part of the discussion. As well, we talked about supply chains, really getting drugs and technologies to where they need to be. We had a representative from the World Heart Foundation talking about very basic preventative measures for CVD are not making it to primary care. What do we need for that? We need supply chains and we need task shifting. So all of these were really important components of the conversation. The last thing was really around communication and branding. So as a company introducing a new technology, we need to be very clear on what are the needs on the ground and communicate that to communities, to governments in a way that really resonates, and brand it according to those needs and those values. So that's the end.
Thank you so much.
Thank you very much. And moving into the next theme, that is also one of the flagship projects from the World Economic Forum, the leapfrogging. And you heard from South Africa about leapfrogging and the way the word is being used and overused at this point in time. So maybe I would like to introduce Walter van Kuyen. He's in charge of public affairs and governmental affairs at Philips. We know each other very well. And the floor is yours, Walter.
Thank you, Arnaud, and would like to share with you some of the very inspirational dialogue we had, particularly because we had the honor of having 4 of our future leaders here at the table as well. We really concluded on leapfrogging, and it was our topic, by the way, innovation and leapfrogging, that it's not about technology. I think you already said it. It's a holistic approach to innovation through innovative collaboration really focused on health system strengthening. That is the kind of impact that we're looking for. So we took around the table, we took an end-to-end approach. An end-to-end approach discussing continuum of care on different disease patterns. How can you connect community solutions to primary health solutions? And then connect them to, again, secondary and tertiary care. How can you create engaged and informed patients and communities? How can you use data and the ability to create the power and the ability to triage, predict, and manage? And how can you deal with techniques and solutions that we apply in the private sector to manage overloaded healthcare systems through process and workflow innovation? So we really didn't talk about necessarily what each stakeholder could bring to the table. It was almost by nature that we were talking about how can we connect the dots to create an impact, and how to turn some of these successful pilots that do exist around the world into, and it was talked about the forest here, how can we explore unique partnerships to scale those? Because no one can do this alone. No one can make that sustainable long-term impact alone. So I think what became very clear is that we need to collaborate to create a new future, a new reality, and that collaboration will take place around shared values. So I think we would like to continue to table this, Arnaud, as a WEF agenda, and even strengthen it, because these are the kind of new collaborations that we're also talking to with several other partners. And as I learned in Africa, if you want to go fast, go alone. If you want to make an impact, if you want to go far, go together. And that should be the theme of our working group here.
Thank you very much, Walter. There was another table working on the same theme, leapfrogging. And John Adesyorie from Ethiopian Consulting has been advising on the formation of public-private partnership. You have been actually working on one particular project in Nigeria, right, in Calabar Hospital. I would like you to report as to what the findings have been of your table.
Thank you. As far as our table is concerned, something has become obvious based on the conversation around the room. It's very important to actually take things from pilot to scale, because ending at the pilot level it doesn't make as significant an impact as when you actually bring these things to scale. The other thing that we mentioned quite a bit on the table is the hub and spoke model, in which you can actually have a central figure, a central organization in your healthcare system that can help develop things around it, which is one of the things that we're actually looking to do in our project as well. Other things were mentioned as low-hanging fruits, including having accredited pharmacies to make sure you're getting the right kind of drugs, quality drugs to the market. At times it's not just about how much it costs, but are you actually getting the quality to the market, not just medication, vaccines, and all that. One of the things that was mentioned is the fact that you have to actually work within the system in which you're trying to develop. You have to understand what kind of, for instance, South Sudan, they're talking about hospitals. You want to know that if you're telling someone to go to the hospital, they understand exactly why they're going, and not basically just the fact that they're going to the hospital. So you have to understand the system in which you're working. And with PPPs, it's becoming increasingly important that there has to be policies and advocacy around it, especially in countries where change of government can significantly impact what's happening in each project. So there has to be policies and advocacies around PPPs. One other thing that was mentioned is, where does NGOs fit? They say public-private partnerships. There's a question as in, are they part of the public end of things or the private end of things? So these are a few things that we actually talked about on the table.
Thank you very much, John. Very instructive and good insights. We'll move into the last table. I think we forgot no one, right? Otherwise, raise your hands. Last table about Ebola. And obviously, Johnson & Johnson was going to talk about Ebola in the person of Alan. You have been very, very involved as a corporation, as a person, Alan, and I would like you to report for the table, and then we will ask Joanne to say a few words of conclusion, and we'll finish a little bit over time, but I hope you had a good session this morning.
Thank you, Arnaud. I'm going to stand because I can't see anyone over there on the other side of the room. So here at this table, we started off by talking about a few examples of effective public-private partnerships around the Ebola response. And we had 3 that we talked about specifically based on the experience of people at the table. The first was a collaboration between IntraHealth, UNICEF, and Johnson & Johnson on phone-based platforms to connect health workers and ministries to communicate in the outbreak zone. The second was the IMI, the Innovative Medicines Initiative, a collaboration between the European Union and pharmaceutical companies that issued grants for both the development of Ebola vaccines, diagnostics, and also for awareness and acceptance and communication around vaccines. And those grants were extremely effective in supporting the rapid acceleration of development of Ebola countermeasures. A third partnership we talked about was really a private-private partnership across different business sectors between UPS and Henry Schein around creating a global reserve of personal protective equipment so that for future emergencies, those supplies would be in place and ready to move rather than having to scour around to get the supplies together to distribute to where they were needed most. When it came to future public-private partnerships, we focused on what would make them more effective, and there was a single overarching theme that came out from our discussions. Many of those points were brought out already, so I'll deal with it very briefly. But essentially, really to come to the table with the mindset of partnership rather than a mindset of competition. The theme of trust and transparency was already mentioned by many of the other tables. Arnaud mentioned misalignment of incentives, but there can't be alignment of incentives unless there is transparency around agendas. So we need to be transparent around our agendas. There's a real opportunity here. All of the effective partnerships, most of the effective partnerships around the Ebola outbreak were essentially fixing the roof when it was pouring. And many of these had to be brought together quickly with a lot of learnings along the way. We have an opportunity here to engage the private sector together with the public sector in order to prepare for future outbreaks and emergencies. So a couple of things were mentioned. One question came up before around identifying which products are in development, what's out there, what it is that we can potentially bring forward. I'm going to respectfully disagree with my colleague from the infectious disease table about lack of transparency about what is being invested in R&D. I don't know if that's necessarily the issue. It's more what it's being invested in than how much is being invested. And if we could come up with a mechanism to be more transparent with public health authorities about what's in the pipeline, then we may be able to develop mechanisms to partially develop those products, to bring them forward past the point of safety and immunogenicity, so we can bring them straight into widespread clinical usage as part of phase 2 and phase 3 programs, rather than having to start literally at step 1 in the midst of an important outbreak. And that's an opportunity to work on right now. And potentially another area is when we're talking about preparing for detection and response to future outbreaks, bringing the capabilities of the private sector to the table, be it in R&D, be it in logistics, supply chain, to the table now to pre-plan along the lines of the UPS Henry Schein partnership, I think will also tremendously increase the efficiency around response to future health emergencies. Thank you.
Thanks so much. Thank you to everyone in the room, and thank you to our live stream viewers. I think we've learned a lot in terms of the intersection between public and private sector. I really recommend our live stream audience to continue submitting suggestions that we've seen today, comments, so that we can fully flush out a good report. I think one of the things, too, that is important and came out of the conversation is really the need to include the healthcare workers, not only from a technical perspective in terms of training, like GE has been doing, but also in terms of engaging with the practitioners on the ground. You know, we have IntraHealth here, Pop, who's been doing such great work in, you know, the healthcare workers, and that's important. And especially the role of women and girls as healthcare workers. And I was talking with Kate earlier about, you know, a lot of the security issues. And I think both private and public sector need to look at the role of women and girls in these PPPs. You know, how is it fruitful, and how is it that you increase the collaboration, not only because I'm a woman, but how do you get women leadership in a lot of these PPPs? A lot of the PPPs that I have been looking at are really male-driven. So how do we include more the voice of women and girls in this discussion? Thank you so much, and I welcome you to continue your conversations around the table, but we're going to end our live stream right now. Thank you.